your grandpa have diabetes?
Yeah, he does, but I don't really know much about it.
Well, I'd love to explain just a little bit that I learned in my nutrition class.
Oh, awesome.
So first I want to explain how our body normally processes sugar. So if I eat a big old slice of bread, let me show you this. So if I eat a slice of bread, it's going to convert into glucose, and then that glucose is going to go into the bloodstream. And so we need to get the glucose in the bloodstream into the cell. And so insulin is this key that unlocks the door to the cell so that glucose can enter in and that the cell can use the glucose for all of its metabolic processes. But with diabetes, what happens is that the body is resistant. With type 2 diabetes, the body is resistant to this insulin, and so it is unable to unlock the door to the cell to let the glucose into the cell. And so one of the major reasons is that a lot of people with type 2 diabetes are overweight, and so the excess fat causes almost like this block on the door so that the insulin can't get into the cell. And so when talking about diabetes, we want to know some signs and symptoms. It can cause excess sleepiness, a sudden loss in weight. You might have blurred vision, or maybe you're all of a sudden hungry all the time. You might have trouble with wounds healing. You might have to urinate very frequently, and you might experience this like numbness and tingling in your hands and feet. You also might experience vaginal infections and sexual impotency. Okay. And so along with diabetes, you might experience some complications, and the first is that you might experience this nerve damage in your eye, and that can cause visual impairment or vision loss, and that can be long lasting. You also might experience kidney disease, diabetic kidney disease, and so with that there is damage, and that's pretty hard to reverse. And then you might also experience nerve damage, and this nerve damage usually occurs in your hands and your feet, and that has longer lasting effects too. And then along with that, along with diabetes, usually is this increase in cholesterol and your triglycerides, and so this can lead to a heart attack or a stroke, which is pretty serious stuff. And so if we want to talk about the causes of type 2 diabetes, there's just a few risk factors that can kind of combine and make you more susceptible to having it. And the first is that if you have a family history of diabetes, you're more likely to have it, and as your age increases, you're more likely to get type 2 diabetes. And these are all causes of type 2 diabetes. And then also if you're overweight, that's a contributing factor. And if you're a couch potato, it just lack of exercise can cause an increased risk for type 2 diabetes. And so, yeah, that's it. Do you have any questions?
No, not really. It was really good to get to know more about it.
Yeah, it's really cool. And then, so I guess also with treatment for type 2 diabetes, because your body is resistant to insulin, things like losing weight and increasing exercise can help you get better. And then also, a lot of people have to take insulin into their bodies because their body isn't able to produce it like we normally can. And so that's it. Thanks for listening.
Thank you, Bridget.